it's been a 12-year journey where in 1998, when I had my first LASIK, it didn't turn out as planned. Obviously, I had done what I thought was considerable research and things sounded promising, so I put my trust, and the results left me with 3 conditions that needed to be treated rather than the one that I started with. It was a bit discouraging at the time because I could not see near, I could not see far. Glasses made no difference, it just made the blur and the distortion larger. Fortunately, at some point, well, actually let me back up, they did a retreatment trying to further correct, which really didn't help, very little change. And then a few months later they told me to try contacts, which fortunately a soft contact allowed my eye surface to be smooth enough that it allowed my vision to come within what's the legal driving limits for the United States. I must say that before my initial laser, my best corrected vision was 2015. After my right eye was 2050 and my left eye was 2070. With contacts I got to 2040 and still around 2050 in the left eye, maybe even a little bit 2060. The left eye was botched up pretty bad. But the 3 zones, one, they made the optical zone too small, they didn't get the prescription correct, and they didn't have the technology that they thought they did to keep the surface smooth enough that I could have quality of vision. Many doctors and research scientists, doctors with laser technology, have been very kind and very open and helped me to understand a lot about technology and its limitations. And as I understood more, it helped me to better understand whether a treatment center that offered treatment would make sense. So it did keep me clear from some situations that I think I would have come out possibly even in one situation blind in my left eye. I won't go into all of the details, but it's been a 12-year journey. It hasn't been taken lightly by me. I have spent weeks, months worth of actual time researching and trying to understand and trying to find doctors who have the ability to not only understand the technology, but the experience that they have used the technology. I live in the U.S. and generally what I've seen is that while there's many advertisements that proclaim a treatment center is the best, well, I know personally, after being in personal direct contact with them, sending them my records, even sitting across from them just like we are now, that all of a sudden the limitations became apparent, and what was considered confidence all of a sudden turned into meekness. And they recognized, and I appreciate that, because I wasn't looking for someone to take lightly and say, sure, we can do this. There were those that even presented that, but their technology didn't make sense to me. And again, not being a technical expert, but for whatever the piece is, whether it just didn't seem right, knowing what I've experienced, because now I've seen it from the other side, I know what the mistakes look like, and I could visualize that it just didn't feel right. I was referred to Accuvision by name, but as a reply to an answer to a single question, and it was only a single answer, and it was a well-known, at least from what I researched, a well-known research doctor, and he befriended me over many years, and we watched technology together, and we talked for hours on the phone, and I reached the point where I asked him, I said, where would you go if you were in my situation? And he said, Accuvision. So here I am, 12 years later. The thing that's impressed me with Accuvision, and I didn't realize it at first, is that it is a team. And it's more than just one person making a decision. It's more than just one person reviewing the records. It's more than just one person who cares. All the way from my first greeting to even now, I've recognized that there's not only a professional approach, but there's a caring approach. And I believe, from my experience, that Accuvision treats each patient as if they were treating themselves. And I guess in America they say the bottom line. Well, the bottom line is the results. I came here not expecting to walk out with perfect vision. I came here expecting to have an improvement in the quality of my vision. Whether I needed glasses I accept that. And to my delight and my surprise, right now my near vision is almost perfect. I'm bordering on 20/20, if not already in the right eye, and still in the healing process only a few days later. And I couldn't be happier. I just couldn't be happier. For the first time in my life, I'm functioning without glasses.